I guess I've been a nurse for over 45 years. I did trauma helicopter, ICU, a lot in the hospital, and then worked my way into nursing education for 15 years. But recently in April, I separated from the corporate world and decided to start my own business for my passion on patient safety.
Hey everyone, welcome back to the Walk to World podcast. If you're tuning in on YouTube or any of the podcast directories, make sure to do yourself one teeny tiny little favor and make sure to give us a follow. I don't want you to miss out any of the amazing guests I got coming on this year. Without further ado, I got a very special guest today. If you guys been keeping up, in October, I went to a public speaking workshop, got to go to New York City, speak at a couple schools, and then I got to speak at my old college that I used to go to. And it was a dope experience. The last night we ended up having a dinner, and I got to meet some of the other people that were in the speaker mastermind. And this lady that I'm going to be introducing right now, we had a dope conversation. We were sitting down at dinner talking for maybe like an hour and a half. I don't remember. Time kind of flew. And I was like, hey, you want to hop on a podcast? And she was like, yeah. And so fast forward a few weeks, or it's almost been about a month since speaker school. So yeah, so fast forward a month. Time is flying. Dr. Julie, for anyone who hasn't had the pleasure, the opportunity to get to know you, to get to meet you yet, just tell us your quick elevator pitch. Who are you and what do you do?
Thank you, John. I appreciate being on your show and talking to your audience here. Yes, I guess I've been a nurse for over 45 years. I did trauma helicopter, ICU, a lot in the hospital, and then worked my way into nursing education for 15 years. But recently in April, I separated from the corporate world and decided to start my own business for my passion on patient safety. So that's been the last 7 months, is building this business so I can bring this message and education and inform people, patients, and their families how to be safe in the hospital and the healthcare system.
Amazing. Before we dive into like what you do for business, all the amazing stuff you got going on, take us back in the time machine. What was little Julie like before the doctor, before before the business, before all the years experience? Like, were you always someone that was interested in like health, or were you like the mother of the group? Were you nurturing as a kid? Like, where did this all kind of stem from when you were growing up?
Yeah, I was the second to the oldest of seven children. And then my mom said to me when I was trying to figure out what I wanted to do after high school, why don't you be a nurse? Because she always wanted to be one. And it's the best decision I ever made. So I started nursing school at 17 years old and kept going with my education and expanding my knowledge base. And it just has always filled up my heart because
Mhm.
you can always make a difference in someone's life. You know, we all can with a smile or just a touch of the hand, but as a nurse, you have that opportunity multiple times a day.
Yeah, I mean, a lot of people my age, right? They're stressed out. They're thinking like, especially the ones in college. I don't think I might have told you, but I mentor students at UConn, and one of the ones I'm mentoring this semester, he's like kind of stressed because like he doesn't really have a clue as to what he want to do. He has an interest in music. He's in the marketing school, and he's doing well, but he's kind of like just like I don't know if I like want to do this music thing. I've been doing it for years now since like middle school, but like in terms of like actual business and like using my degree and what comes after. And I think he's a freshman if I'm not mistaken. And it's like, listen, you don't have to have it all figured out. Like for me personally, I pivoted a ton, and I talk about that all the time in the podcast. But you were you hopped into an industry and wrote it out for quite some time. So like, what was kind of that like around that time? Was like, did you have any doubts of like whether this is the right decision or not? Did you ever have any thoughts creep in of like, hey, maybe I should go try something else? Like as I said, there's not many people at that age that find something they enjoy and then ride it out for as long as you did. Sometimes they maybe like a year or two and then they pivot and do something else, or they get a degree in something and end up in a completely like not adjacent industry or that has nothing to do with what they ended up studying. So like, what was that kind of like?
You know, I worked on the oncology floor, my first job in the hospital, and that was a tough job. I loved those patients because they really just needed tender care, right? They've got this diagnosis of cancer. And that was emotionally draining. And then I had an opportunity to go learn more and expand. And that's the cool thing about nursing and what I've experienced in my career is if you kind of learned what you think you've learned about that area of nursing because it's so broad, right? So then I went to the cardiac step down unit and I loved it, learning about dysrhythmias and, what happens when the heart goes into atrial fibrillation. And then it prodded me to take care of even sicker patients. And so I went to the ICU for quite a while, and you learn about, that type of in-depth, really sick acuity type patients. And so that's how my career has been really fresh for me, is I always want to learn something new. And especially if I get comfortable doing something, I'm like, okay, well, now I can take that skill set and apply it to, then, like, after ICU, I went to fly on the helicopter, which was amazing. I've said many times, I can't believe they paid me to do that job.
Wait, so you flew helicopters?
I was the nurse in the helicopter taking care of,
No way.
in the back. So we had trauma victims. We'd fly out to. I was based in Vegas, Las Vegas, and fly out to the lake for a boating accident or jet ski accident, and then we, would fly out to the canyons where a hiker fell, or these little clinics that were really far away from Las Vegas, but had like somebody having heart palpitations and dysrhythmias, and we'd fly out and pick them up. So yeah, you never knew what you were going to get. That was cool.
Yeah, that's dope. And so, remind me again. So you were in the nursing industry for, you said, about 40 years, you mentioned?
Yeah.
And so were there any like side hustles along the way? Was there any like times in your life where you had to do like two jobs at one point? Like, or was it always just nursing?
I always did nursing, but the one thing that bothered me the whole time was I could be the best dang flight nurse on the planet, and I'd still only make, $25 an hour or whatever I was paid back then. It didn't matter if I was the best or the worst, I was making the same pay. So I actually tried
Hmm.
medical device sales for a little while, about a year and a half, because there you get promoted and you get your bonuses if you do really well, which I loved it. And then the company changed. I went back to nursing education. But I think that's why I'm so excited to be an entrepreneur now, to take this
Hmm.
knowledge that I've learned over 4 decades and really apply it to something meaningful, but also that can be monetarily rewarding.
Yeah, no, 100%. And I'm curious too, like, what was that medical sales job like? Because, well, at least from this typical, like, stereotypical, I guess, thoughts that come to mind when most people think of a nurse is like someone that's more nurturing, more loving, more caring. Versus when you think of someone that's salesy or in sales, think of someone that's sleazy, sometimes conniving, very good with words, sometimes very charismatic. Sometimes it could be very, very, different. At least if you just go based off the stereotypes for both industries, right?
Yeah.
So like, what was it like kind of making that transition into sales? I know it wasn't a big, big portion, but like, what was that like?
It was interesting because they didn't typically hire nurses because we just had a different personality, like you just pointed out. But it was
Hmm.
interesting. I had 7 interviews, and what clinched the job for me was the regional director had flown into Las Vegas, and we were meeting at, shoot, which hotel was it? Anyway, and I couldn't find him, and he couldn't find me. And instead, I went looking. I called somebody that could find out his number. I mean, I persevered to find this guy. And he goes,
Yeah.
everybody else would have given up. So he got the job. But I think what I loved most about it was I was selling patient monitoring devices. And so I had 4 different monitors, and it was really about education. Because if the nurses or the physicians didn't know what this monitor did to help make the patient safer, then I wouldn't sell anything. But after I would show them, hey, this is how we can make the OR experience better with this one monitor that would be on the forehead, but it would tell perfusion through the rest of the body. And so the anesthesiologist, if he had the head just a little bit off instead of center, it would diminish the blood flow on that one side. And he thought that was the coolest thing. So it was a lot of education. And I think those are the best salespeople that help people solve a problem, right?
Yeah, yeah. Let's kind of dive. This is a pretty interesting topic because you hear often too in sales. It's like a lot of people think sales more of persuasion
Mm,
more than it is education, and I like that you brought that up because I think from what I hear, right, the best thing you could do when it comes to sales is help people come to an informed decision. Now,
yes.
whether that decision is yes or no is a whole nother story, right? That doesn't matter. It's just giving them the information that they need to make a decision that best align with what their goals are. If their goals align with whatever you're selling, well, then the best decision for them is to be in your product and or buy your product or service. But if it's not, then the best thing for them to do is not buy it at all, right? Not give it a chance, not you do a free trial. It's like, no, if it's not the best option or it's not a good fit, just don't have them buy it, right? And so, what kind of like, how did you come to that realization about education? Especially, I feel like because back then sales was a lot more direct than it is now. I feel like now people are a lot more empathetic and, as I said, educating when it comes to their sales. I mean, and now I may be a little ignorant to what it was like back then, but at least from what I hear watching these old school marketers and how they, talk about sales and marketing, persuasion, and that stuff, it seemed very different than like the new school of marketers that you see. So how do you come to that realization of education?
You know, I learned a lot about those monitors because I didn't work in the OR prior to that. I mean, I'd worked in a lot of areas, but when I learned that, I'm like, oh my gosh, I bet you if I didn't know it, a bunch of people didn't know that. So that's the approach I
Mm,
took. Exciting. And there was research already, which everything I like to be evidence based. And so pulling
mm,
articles and sharing, hey, in this study, this is what they found. This is what happened and how they had better outcomes. And that always was the foot in the door, so to speak. Hey, were you aware? Well, let me share with you. And it was sharing that type of knowledge that, like, oh, tell me more. Yeah.
yeah. Okay. So you were in medical sales for a little bit. Now fast forward a little bit. You go back into nursing,
Mhm.
and then you rode that out for again some time. And then around when did you start getting the idea of like, hey, maybe this might not be the thing I end up doing forever? Was it like a gradual thing where it's like it happened over a few years, just like, and then finally you got a point where you're fed up? Or was it like a quick snap moment where it's just like, I'm through with this entrepreneurship time?
It all kind of culminated to when I was doing my master's thesis, and I chose the topic of something called failure to rescue, which is, again, in the literature, but it's nurses not recognizing when a patient begins to deteriorate. And I was like, I was already a nurse for 30 years. How did I not know this? Because I was never taught this and it's not in the nursing curriculum. And so it intrigued me to, hey, we've got to tell all of our nursing students about those physiological cues, whether it's an increased respiratory rate, whether it's a low heart rate or a fast heart rate, or neurological changes, they happen 6 to 24 hours before the patient goes into cardiac arrest.